The training, designed to address gaps and broaden religious leaders, teachers, and key actors' knowledge of sensitive issues revolving around sexual and reproductive health, is organized by the Ministry of Basic and Secondary Education with support from the International Development Research Center, IDRC, in Canada. The curriculum developer, Ministry of Basic and Secondary Education, said the training stems from findings of research conducted to assess gaps in comprehensive health education, stressing the significance of the training towards building the capacity of key actors.
The program is intended to train the religious leaders and Islamic teachers as well as the Christian teachers, so that at least we can share with them the research findings that were conducted. Okay, you know, the comprehensive health education is very key, but I mean, we have religion, the way they view it, maybe a bit different from the liberal man. And now we have a non-secular society whereby, you know, at least, I mean, there are certain things that, you know, are very key and they must be paid heed to.
Comprehensive health education forms part of the Ministry of Education's Access to Quality Comprehensive Health Education Policy under the Curriculum Research, Evaluation and Development Directorate, meant to enlighten and educate the masses and students about adolescent sexual and reproductive health.
This is an area that is very important because it affects us. When I say us, that is the young ones, and especially the generation yet unborn. So it's important that we know about it and be able to pass the message to the young ones in terms of educating them. And I've seen it as a responsibility as a teacher to know about it and be able to speak about it as well, to inculcate it in our lessons as we are teaching, yes.
Drawing lessons from the previous health and reproductive training programs, organizers lamented the unprecedented increase in sexual and reproductive health infections, unplanned pregnancies, and the controversial issue of FGM.
The training is going to center on that, especially FGM, which, you know, is a burning issue. Okay, despite it is somehow religious or traditional, but then it harbors certain impacts. So if the religious leaders themselves to clarify and elucidate on this literature and then tell us that whether it is a sunnah or not, at least during these 3 days, we'll share with them what research has shown.
We have a subject called fiqh, even in our Arabic schools. That's where when you about to teach this subject, you don't need to be ashamed. You explain everything to them. That every human being, especially a woman, God, the way God created you, you are in seal. Now these days, our society, you can't imagine. Even in school, teachers are, you know, they are really trying. But it doesn't stop there. When teachers play their role, when they come home, you as a parent also, you also play your role. Sit with them, talk with them.
The 3-day training will focus largely on sexual and reproductive health law, on safe abortion, but will as well deal with the use of contraceptives, as well as values and culture. Organizers are also expected to hear from religious leaders Islam's perspective on the sensitive issues. Alagie Mbye, GRTS.